Hello, my name's Ian Setchfield and I'm an acute care nurse consultant in East Kent, and today I'm just going to be talking about my journey as a whole system leader. We all know there's a plethora of leadership publications available to us, written by organisations such as the King's Fund, NHS England, academia, seminal papers on leadership styles. And all of these papers are really important, but I'm not going to be focused on that today. This isn't a presentation on transformational leadership, the positives and negative aspects, etc. It's about my journey. So this is where my journey started. It started on the 3rd of September in 1991 when I joined the Royal Air Force as a nurse in the Princess Mary's Royal Air Force Nursing Service. And during my time in the RAF, I developed not only my clinical competence, but also the development of leadership toolkit, although at the time I probably didn't realise it. My specialty was critical care, so I became part of the critical care air support team, and this required me to operate from various operational theatres or provide aeromedical evacuation worldwide, working with a small team. And during my time in the RAF, my leadership skills developed, and as I said before, it wasn't something that I was consciously aware of. It was just part of the career progression pathway, which led me to become a senior non-commissioned officer. On reflection, what I didn't know at the time was that my toolkit was providing me with different leadership theories such as adaptive leadership, top-down approaches, and compassionate leadership. And the other big enabler that I took for granted was the strength of effective teamwork and a positive work-based culture. So when I joined the NHS in 2005 as a Band 6 charge nurse in an ITU in a district general hospital, I think that was the most difficult thing for me to come to terms with, was this apparent lack of effective teamwork and camaraderie, along with the complexity of leading in the NHS compared to the Royal Air Force. The skills and experience that I gained within the Air Force enabled me to take opportunities available to me, and within 18 months I was the acting matron for the intensive care unit and critical care outreach, which became substantive in 2008. I honestly feel it was these transferable skills such as positive role modelling, the ability to use emotional intelligence and strategic reasoning that enabled me to succeed, and also allowed me to gain more exposure of the organisation. Two things happened that provided me with the opportunity to develop both my career pathway and my understanding of leadership theory within the health service. Firstly, in 2013, undertaking the Trust Aspiring Consultant Nurse Programme, which was facilitated by Professor Kim Manley. And then in 2014, being on the first intake of the NHS Leadership Academy Mary Seacole programme. The Aspiring Nurse Consultant Programme ran over a year, and that was really instrumental in my beginning of my leadership journey. The programme required us to look at the value and impact of the consultant nurse role and really focus on the other three pillars of consultant nurse practice, such as leadership, strategic awareness and education and research. And we learnt new tools such as claims, concerns, issues, value clarification, active learning sets, and understanding the political context of my own organisation, but also the whole healthcare economy. It was during this time that myself and a colleague were able to pitch to the exec team and trial a 6-month pilot of a consultant nurse post in medicine. This provided me with a platform to put theory into practice, using my clinical credibility and leadership skills to influence the workplace culture and ultimately demonstrate the impact and value that the role could bring to the organisation. At the same time, I was undertaking the Mary Seacole programme, which was advantageous as it provided me with a great understanding of the different leadership theories. It enabled me to understand my learning style and, more importantly, identified elements from other styles which I could use to augment my own personal leadership style, which, if I'm being honest, is probably kind of an adaptive leadership style. transformational leadership. But it became evident that in order to progress as an effective leader and change agent, this development of a toolkit was essential. This kind of accumulated in the production of a report for the executive team, which then convinced them to advertise the position substantively. Participation in the Aspiring Consultant Practitioner and Merit Equal programme has provided a challenging platform with which to develop both the theoretical knowledge of effective leadership and the practical application of that knowledge. Whilst on the Aspiring Consultant Nurse programme, I had the opportunity to work as a research assistant with Canterbury Christchurch University on a Health Education England, Kent, Surrey and Sussex project looking at transforming urgent and emergency care. This project looked at the whole healthcare system, professional bodies and service users. Some of the key enablers that were identified in the first phase were that clinical system leadership across the healthcare economy was vital as an enabler, as was the development of work-based facilitators and a single career and competence framework linked to an NHS career framework. Needless to say, it was during this time I developed an interest in whole system leadership and how it lent itself to my role as a consultant nurse. The second part of the project was the development of facilitation standards. So whilst King Funds talk about whole system leadership, one of the things that we found with the project looking at transforming urgent care was clinical system leadership. The definition by Manley et al. Is on the screen, but why clinical system leadership is so important is that it enables a shared purpose and direction, creates a learning culture which enables workforce growth and sustainability, and also allows you to grow skilled facilitators who can then use the workplace as the main place of learning, so driving forward improvement and development pathways and looking at patient-centred pathways. And that's probably where my journey's kind of moved me towards. Obviously, clinical system leadership and whole system leadership are intertwined, but it's that clinical system leadership, looking at having that clinical credibility and working with shared purposes to break down the silos, that is something that I'm really passionate about. In my role as a consultant nurse, I've continued to develop myself, getting involved in local and national work streams. But I wouldn't have been able to do any of that if I didn't have a strong foundation with my leadership, and things such as the guiding light principles, the Venus model and shared purpose frameworks have all provided me with that really robust foundation with which to kind of continue my development. One of the projects that I've been involved in the past was with the England Centre of Practice Development, and it was looking at safety culture. It was called the Squire Project, and some of the key themes that came out of this project was that it demonstrated the most influential factor on embedding safety culture in frontline teams was the quality of the clinical leadership, and that by having quality clinical transformational leadership you could achieve and sustain safety cultures in frontline teams by enabling them to develop effective teamwork, develop that shared direction and co-constructing values, and that it was a safe environment for them to kind of put challenge in or try new things, and that actually organisational facilitators are an important resource for supplying frontline teams. So that kind of goes about growing a cohort within the organisation of like-minded people that can act as change agents, so they are able to kind of facilitate that they can kind of coach and mentor more junior members of the team. And that's in order to build capacity, organisations across the system for quality improvement and innovation need to ensure that they have effective leadership and growth facilitators. And this led me then to look at a clinical pathway project called the Tiers of Care. And basically, it just mapped the patient's journey and kind of decided who needs to see the patient at the right place, right time. And that could be the GP. That GP could resolve the patient's problem at their initial consultation, or it actually might be that the GP then needed to refer them on to tier 2, which was specialist tier. That could be a respiratory nurse specialist, a first contact practitioner, or an advanced clinical practitioner for further investigations or assessment. Or it could be that actually they needed to refer that patient to tier 3, which was secondary care, so going straight to specialist input for specialist investigations or review. And we did those across a multitude of clinical pathways on rheumatology, respiratory, ambulatory care. But as I said, none of that I personally feel I would have been able to kind of do if I hadn't got a really strong foundation, which was, I say, built upon the principles of the Venus model, guiding lights, shared purpose, etc. So my journey to date, hopefully I've been able to kind of demonstrate it and discuss some of the key elements which I think have enabled me to kind of become an effective whole system clinical leader. My journey's not over. It can never be over, I don't think, if you're being honest with yourself, because you can always improve upon yourself and become more effective. But my journey's allowed me to facilitate aspiring consultant practitioner and clinical leadership programs within my own organisation. It gave me the confidence to apply to become an international fellow for the England Centre of Practice Development, the Kent Surrey Sussex Leadership Academy reference group, and also then to kind of take on more national influence by becoming part of the Society of Acute Medicine's National Committee and the RCM Professional Nursing Committee. But where I see my journey continuing is around advanced practice. So all of those things that I've just briefly discussed have enabled me now to channel them into developing advanced practice within my organisation, and also working with Health Education England to influence the national agenda for advanced and consultant level practice. And when I say it's enabled me to develop advanced practice in my organisation, it's not just the technicalities of introducing a new innovative workforce, but it's also making sure that I embed within my trainee ACPs that they are able to act as positive change agents, that they promote the workplace as a valuable place of learning. They could do this by just doing bedside teaching with a new member of staff, but they participate in multidisciplinary education sessions at M&Ms, they present nationally, they act as positive role models, and they are developing, ensuring effective clinical leadership, because they're bringing all that tacit knowledge and experience that they have as experienced nurses, physiotherapists, and we're just able to develop a senior clinical pathway, but also use the other 3 pillars of advanced stroke consultant level practice to really drive that kind of transformational change in the workplace. COVID-19 has presented us with a unique set of circumstances, or challenges probably is more the right word, to make us look closely at the importance of developing resilience within the workforce, making us question our workplace cultures. Are they positive, or are they negative? Are they effective? Do we work well as a team? I think we have been able to demonstrate in the health service that actually frontline kind of clinical leadership has been essential to drive through the rapid changes that have been required to us to adapt our work environments, or actually our roles to kind of manage the COVID-19 pandemic. There's reports coming in now from Health Education England looking at the impact advanced and consultant level practice has had on COVID-19 within organisations. So I think as this kind of information becomes more public and more published, the tools that I found essential on my journey will be able to be used to kind of strengthen resilience within teamwork, really kind of now try and drive forward, I'll say, that transformational change, looking at a whole system approach. How do we do our business? Is it best for the patient? How can we invest in different education needs for our teams so they can work flexibly in the future, etc. But I couldn't not talk about my journey without talking about what I think personally is my most important influencer, and that's been Professor Kim Manley. Without her supervision, her support, her guidance, I wouldn't be sitting here today talking to you about my journey of how I think I work as a whole system clinical leader. So I hope that you found this short presentation interesting. It may have given you some food for thought. Thank you.